welcome to Ready, Set, Grow, a monthly podcast of the Loudoun Education Foundation. I'm Danielle Nadler, Executive Director of LEF, and I am here with Susan Carroll, President of Inova Loudoun Hospital. Susan, thank you so much for being here.
Thank you for having me.
Yeah, we're really excited. You all may know Susan. I've gotten to know really well over the last couple of years in her current role at Inova Loudoun, and I know she's been there for many years, so we'll hear about that a little bit. But I know, Susan, kind of first and foremost, would you consider yourself, it's a parent. You're a longtime Loudoun County parent. So would you share a little bit about your family and your background here in Loudoun?
Sure. My husband and I bought our house in Ashburn in 2001. So we've been residents in Ashburn for a long time. Both of my children one has completed through Loudoun County Public Schools. He's a junior in college right now. He goes to Elon University in North Carolina. And then my youngest son is a senior at Briarwoods. But both my boys have gone straight through all Loudoun County schools. We like to say, my son likes to say, they're all birds. We were Hillside Hawks, and then we were Eagle Ridge Eagles, and now we're Briarwoods Falcons. And so we've been very active with our school system and with our kids. Our kids both played varsity sports, 2 varsity sports. They're both golfers and baseball players. And my youngest son is very engaged in student government. He's student government president at Briarwoods this year, too.
Awesome. How do you feel about that senior year, kind of wrapping up that LCPS experience as a parent?
I think it's different with their second one. There's different emotions. I think my oldest son, every single thing that he did that was his last event, I was sad and I cried about. I think with Cooper, I know that he's going to be really well prepared for wherever he goes. I was very nervous, I have to tell you, when my oldest went off to college. Just thinking socially, academically, he was a COVID. COVID really hit him really hard during high school. And I was worried, how would that work? He's also a quieter kid, and seeing how he's grown and blossomed. And he was extremely well prepared for college, even going through COVID.
Wow.
So I think I don't have those anxieties that I did with my oldest. I believe that Cooper is also a very adaptable child, and I think he doesn't know we're not worried about where he's going to go to school. He's gotten into a bunch of schools, and he's still waiting to hear from some, and we kind of know wherever he's going to go, he's going to do well.
Yeah.
So I have that I'm not as anxious about. But thinking about being an empty nester, I think is a mixed bag of emotions. I think I'm excited. My husband and I have a little list of trips we're going to take, and places we're going to go, and things we're going to do. We joke, my son has a seafood allergy, and so my husband last night said, we're going to eat shrimp once a week. Yeah. Right, silly things like that. But then I think also too, now that it's the holiday season and you spend a lot of time with your family, and my other son was home last week, I worry that I will be lonely. We've had so much, and it's not just, one thing I think too is, it's not just about your kids leaving. Last week my son's friends from college came home, and they came by to see me.
Right, yeah.
It's where lots of kids are always at and doing different stuff, and it's not just the boys. I'm going to miss all their friends too. Cool. So just that experience of, being involved and having, that community feeling that we have, I think that we have in Ashburn and things like that. So.
Definitely.
Yeah.
Definitely. I relate to that. Just briefly, I grew up in South Dakota, and my mom visited this last week, and she still gets together for coffee with my high school friends,
Yeah. Yes.
Just because it's like our family friends now. Like, we're truly family friends, and I love that. That's so cool. And you're right, enjoying those last great moments before the next really great stage, which I love. And I just, to transition a little bit to Inova Loudoun Hospital's partnership. So some of our listeners and viewers may know that Inova Loudoun is really a truly incredible partner with LEF, the Loudoun Education Foundation, and LCPS. And I'll just list a few, and then Susan, I think the questions I want to ask you is kind of why Inova, why it's worth your team's time, your team's talent and treasure to partner, in a couple of ways that they partner ongoing. Any given day, there's multiple ways they're partnering. Inova Loudoun gives an annual donation to support mental health programming at the elementary schools. They take on over 70 students for Job for a Day. We'll hear a little bit about that. And then your team also serves really as thought partners with LCPS educators as they help inform curriculum and create health science pathways for students, which is to be honest, my background's in journalism. I covered education for 15 years. I don't think I've ever heard of a partnership quite like this. It's not just the check that you send what's here for. It's not just the, hey, we need to work for it. It's, gosh, we are working alongside you to get good work done, and we just thank you for that. And yeah, kind of what makes you all do that? Why is it worth that generosity on your side, would you say?
Sure, I think there's a couple things that drive this. So one, and I said this before at the School Business Partnership, great schools do make great communities. And I think that you absolutely have to invest in your schools. Whether you have children or not, you want your school system, just like you want your health system, you want your hospital to be great. These are public services. We are both mission driven, and we believe, I believe personally, and one of the reasons I love my job and what I do is that I'm privileged to have this job to serve this great community. And serving that community doesn't just mean providing great access to healthcare, which is primary to what we do, but it's really building a strong community outside. And what's a better place to start than with the school system? We want to make sure that we're building we want future employees too. We want future team members. That we love the fact that people would want to come into healthcare. We also love exposing students to many aspects of working in healthcare. You don't have to be a doctor or a nurse to work in healthcare or to give back. You can do anything. My team members, I have engineers, I have architects, I have accountants, I have risk managers, I have, you name a job, and I guarantee you we have it at Inova, a profession. And so we'd love people to see that you don't have to just be a clinician to really be able to work in our health system. And so getting kids early exposure, like in Job for a Day, like Dream Big. We love capstone too. I think that last year we probably had 60 some capstone students who are seniors. Wow. I've always had a capstone student. I think last year I had 4 myself just joining me because we loved people to be able to see the different aspects of how you can come into healthcare. The other thing I think though that drives a lot of this work is, go back to what I said in the beginning in the introduction, I'm not the only one who's a parent in Loudoun County Schools. Right? Almost all of my team members have students, kids, who went through Loudoun County Public Schools who are currently in Loudoun County Public Schools. So that drives us. That drives us to want to make the schools better. We want to make it better for our kids. People want to make it better for their grandkids. They want to make it better for their neighbors' children. So it's this flywheel, right, that we have that once we start, and we give back to the community, we see that benefit, and we want to make it a great place to live for our team members. And doing that is partnering with different programs and specifically with the schools. I think people are passionate about it and really want to be able to give it because the schools touch everyone's life. Every single person in the county, the school system touches their life. So true.
So well said. I feel like you're right on with the ownership. Like, well, we care because it's ours. It's our right. Kids are going there, or our neighbors' kids are going there, or, well, it's our taxes, so we want it to be a great public school system. That's really incredible. And just that idea of Job for a Day, similar to Capstone a little bit, is that it's high school students going and kind of a one-day internship or one-day job shadowing. And we had 5 here at LEF, and it was a really great day. But I was thinking back to those times when I was in middle school or high school, and when I did get a little bit out of the classroom and get a front row seat at an actual career, that's what stuck with me. And that it's those few moments actually that really, I think, help drive a lot of students to what their future career is. So thank you all for doing that and seeing the value in that. That's just huge.
And I think I'm not an educator, but I think educators now realize, whether it's children or adult educators, we're all constant learners, that experiential learning makes sometimes the greatest impact on someone. It's really not just what they see in the classroom, but creating an experience that they could see themselves doing something that, hands-on. And I think that if I think back to times when I've been a learner, not just as a student, but as an adult, it has been really about an experience that was created for me, and that's where I learned. And I think most people, and especially teenagers, really value from an experience like that.
That's a great way to put it. And I know I've heard Superintendent Dr. Spence and Tony Howard, CEO of the Loudoun Chamber, say, gosh, wouldn't it be great if many of the students who are now students stay in the community and continue working and really call Loudoun home for the rest of their lives. And I know, frankly, growing up in South Dakota, that didn't happen with any of my friends because it's, it's not a lot going on.
Yeah.
A lot of career opportunities or it's also very cold. So for Loudoun to, I think, especially the business leaders, to see the value in that and then to provide opportunity to make that happen, yes, that's really exciting.
We love, we have our new grad nurses that we have, and I meet with all of them when they start, and I always ask, how many of you were born here? And it's always wonderful to see the hands that go up, and even our own executives. Right, we have executives that are here that were born here. I was born at an Inova hospital myself, not Loudoun, but Inova Alexandria.
Cool.
And and when I served as the president at that hospital, it was really very special. I would say that people would ask me all the time, well, how long have you been with Inova? I would really be able to be like, actually, my whole life.
The beginning.
I started here.
That's so cool. I love it. Well, fun. Thank you again for taking the time. We always love hearing about your family. I know I've met one of your sons and your husband, and just it's a rock solid. Loudoun is lucky to have you, Susan Carroll.
Thank you.
We're so thankful for your leadership at the hospital and in the community as a whole. And hope you have a good rest of the week. Thanks again for coming on.
Thank you.